Good evening, everyone, and welcome to night 2 of our 4-part town hall series, From Disparity to Parity, Examining Social Determinants of African American Health. I'm Judy Reese-Morse, President and CEO of the Urban League of Louisiana, and we are so pleased to be able to bring you this town hall series in partnership with the Louisiana Legislative Black Caucus. If you were with us last night, you heard and felt some powerful stories of people impacted by COVID-19. Elected officials, a daughter who lost both her parents on the same day to COVID-19, and a community leader fighting for his community, a community that has the highest rate of African American death in the country due to COVID-19. We also heard from the renowned Dr. Denise Shervington, who talked about the mental health impact on all of us. Tonight, we'll look at the relationship between affordable housing and health disparities. We are so pleased to have WWL TV news anchor Sheba Turk with us this evening, who will moderate a dynamic discussion with housing leaders from across Louisiana. Tonight and through Thursday, we're talking about the social determinants that contribute to the disparities that exist. Last week, the Urban League of Louisiana issued a strategies document on reopening the state of Louisiana. Reform, Recover, Reopen, Strategies for an Equitable COVID-19 Response in Louisiana. You can see it in its entirety on our website at urbanleaguela.org. Now, most of us in this town hall meeting know that inequities and disparities for African Americans and other communities of color are nothing new. But we also know that those disparities are made worse during a crisis. We cannot miss this opportunity to respond equitably to COVID-19 and in a way that makes us all better when we are through the pandemic. The Urban League of Louisiana believes that we must look at this issue of reopening through the lens of public health security and economic security. When we talk about public health security, we're talking about making sure that our frontline workers are protected, that they have masks, that they are being tested, that they are working in highly sanitized environments on a regular basis, and that they have access to doctors whenever they believe that they have been exposed to the virus. We're also talking about renters and landlords, making sure that they are not pitted against one another, making sure that both have the resources that they need in order to weather this pandemic. We're also talking about initiatives that look at food deserts. We know that 500,000 people in the greater New Orleans area live in a food desert. So we must make sure that they have access to hot meals and healthy food options during this pandemic. But we must also think about economic security. We must think about hazard pay for our frontline workers, those people, again, who are most at risk of coming in contact with the virus. And we have to keep fighting for the minimum wage, not only for each person, but also to make the economy stronger so that they have more buying power. And we cannot forget about small businesses. Our small businesses are critical to our state's recovery, and we must make sure that they have opportunities to participate in the emergency procurement opportunities that we know exist, as well as getting the resources that they need in order to scale up and to hire those who are unemployed. So the Urban League has been focusing on these issues. We will continue to focus on these issues and fight for these issues. And again, we ask you to stay tuned by being in touch with our website, urbanleaguela.org, where we have all of the information that we are making available to the public. Again, I am so thrilled that all of you are with us this evening. We are recording this town hall meeting so that we can share this link with you following the meeting. If you are a participant, your lines have been muted, but you will have an opportunity to ask questions using the chat function. So if you have any questions throughout the town hall, please use the chat function to enter your question. With that, I would love to turn it over to Senator Ed Price, who is going to give opening remarks on behalf of the Louisiana Legislative Black Caucus. Senator Price.
Thank you very much, Judy, and thank all the participants that's on the line tonight. The Louisiana Legislative Black Caucus is happy and proud to be partnering with the Urban League of Louisiana. We know that this is a very important issue that has come up, especially with this COVID-19 virus, and we want to collaborate and network to make sure that we are moving forward, that we can get things done. And the Louisiana Legislative Black Caucus is proud to be a partner in this relationship. We've had some great relationship, but it's none that's more important at this time than moving the state forward and moving those who need the most forward with us. Tonight's discussion, of course, is centering around equity in housing. You know, we have this social distancing right now, and some of the things we're talking about is stay at home. Well, if you don't have a home to stay at, how can you stay at home? There are so many of our constituents that are out there in the street. You can't wash your hand, you can't do those type of things. So partnering with the Urban League, we will do the things that we need to do, whether it's passing legislation for more affordable housing, whether it's passing legislation to make sure that we're getting our homeless off the street. But we must continue to fight for those who can't fight for themselves. So the Louisiana Legislative Black Caucus is proud to be here with you all tonight. We have several of our colleagues that's on the line who will be discussing some other issues as we move forward. And we welcome you. We welcome you. We welcome your participation. And we always welcome you to the Capitol if there's things that we need to do. So we're going to continue working with the Urban League and any other group that's out there that needs support. We want to support each other. We want to collaborate with each other, and certainly we want to network to make sure that we are getting things working. So thank you very much for having us. We thank you. We welcome you, and we're looking forward to working with you and moving forward. Thank you.
Thank you so much, Senator Price. We are delighted to have you with us tonight. And of course, again, the partnership of the entire Black Caucus for the state of Louisiana. I'd now like to introduce Cy Richardson, who is a Senior Vice President with the National Urban League. Cy is going to give us a big picture view of what is happening with affordable housing across the country. Hi, Cy.
Hey, thanks so much, Judy. And thanks very much for the invitation to participate today. Clearly, the Urban League is on the move and in the mix with regard to focusing on frontline triage of clients and communities, as well as interpreting and narrating the long-term implications of this pandemic crisis. To that end, a key area of inquiry and concern broadly relates to community rebuilding and resilience in Black America, and in particular, affordable and safe housing as one of the social determinants of health. So we might, how might we assess the likelihood, or some might say the inevitability, that this racial health crisis transitions to a more profound and entrenched racial wealth crisis, right? So from my perspective, there are clear textures of connection and intersectionality embedded within this question. I want to just linger on intersectionality for a little bit, because that's how we kind of understand and attack this from a national perspective. Intersectionality is both a specific concept and broader ethos in the social science field. Intersectionality is a theoretical construct for understanding how aspects of one's social and political identities, gender, race, class, sexuality, etc., might combine or layer to create unique modes of discrimination. It also provides qualitative analytic frameworks that identify how interlocking systems of power affect those who are most marginalized in society. The purpose of intersectionality as a theory is to identify how overlapping categories of identity impact individuals and institutions, and take these relationships into account when working to promote social and political equity. The National Urban League employs an intersectional approach to promote the common good for African Americans and communities of color developing programs and policies that link all aspects of community life: housing, transportation, education, retail, jobs, and economic development, for better holistic health for all, the physical dimension, mental, emotional, communal, and spiritual. We believe we must harness this learning to prepare our communities for the human and communal rebuilding phase, which will unquestionably come once the COVID crisis has abated. So we must be vigilant as the Urban League's top affiliate advocates like Judy Reese-Morse continue to find new ways to use policy to improve the places where people live, work, and play. Yet we note that many of the localities that have benefited from such policies have become less affordable, and this dynamic threatens to become more perverse and entrenched. Growth in median rental prices in cities across the country far outpaced growth in median incomes, and the cost of decent rental housing has become too high for average families to afford. So at a time when wage growth remains stagnant and housing costs climb, without strategic action, low and moderate income residents could be priced out of the neighborhoods in which they grew up and want to stay. This understanding is at the heart of the League's anti-displacement work. So what have we learned, and how will we apply this knowledge and experience? As Albert Einstein famously declared, experience is not what happens to a man, or in modern parlance, or a woman, but experience is what a man does with what happens to him. So as we applaud the expansion of full-service grocery stores into former food deserts, as was mentioned, we must ensure that beneficiaries of these investments are the people who have lived for years without access to healthy food. We encourage the transformation of abandoned land into greenways, playgrounds, and gardens. We must also ensure the improvements are accessible to those who can't afford a gym membership. As we work to enforce building codes that regulate the quality of rental units, we must ensure those rental units remain affordable for low and moderate income families. So in short, let's take an intersectional approach. Let's work to guarantee that strategies used to create healthy places benefit all community residents, especially those with the fewest resources. And as my colleague, Nika Morris, will surely preach later on in this town hall, is for preserving, protecting, and expanding affordable housing, which must be our overarching goal, our North Star, as it were. In this instance, the goal, objectives, and strategies can provide public health practitioners, along with their allies in public agencies, community organizations like the Urban League and the private development community, with the tools and tactics needed to preserve and promote safe and affordable housing for low and moderate income renters. In the face of increased demand fueled by changing demographics, private and public investment, and other factors, housing must be on the agenda for all of us who envision a healthier future for all. Thank you, and I very much look forward to the conversation.
Thank you so much, Sai. That was very aspirational, inspirational, and informative. So grateful that you could be with us this evening, and so grateful to you and to Mark Morial, the President and CEO of the National Urban League, for all of the guidance that you provide to us here in Louisiana and to the other 89 affiliates across the United States. Thank you, Sai.
Thanks. You're a real gem, Judy. Thank you.
Thank you. Next, we'll hear from Representative Matthew Willard, a member of the Louisiana Legislative Black Caucus representing New Orleans.
Thank you, Judy. Good evening, everyone. My name is Matthew Willard. I'm state representative for District 97 in Louisiana. My district is in New Orleans, particularly it's Gentilly, parts of Mid-City, and areas around Bayou St. John. Before I go into, some of the housing problems and inequities that we have in the state, I want to first start off by thanking the governor for extending the stay-at-home order for another 2 weeks. That way, like Judy was talking about earlier, we can get some procedures in place to make sure that when our workers do go back, they are protected from this coronavirus pandemic. It's very difficult to tell someone to stay at home and social distance and isolate, like Sai was just saying, if they don't have permanent housing to go to. It's very difficult to social distance and maintain proper hygiene when you're living in a home with 2, 3, 4 generations of families. and that exists. I can tell you, I just ran a campaign last fall to be elected into this position, and I knocked on numerous doors of multi-generational houses. You know, particularly in District 97, we lost 3 family members from a prominent family, strong individuals. They were warriors, the Macmillan family. 2 sisters died a week apart from each other, and then their brother died about a week or 2 later. You know, so that's difficult. So, you know, when anyone says that we're not handling this response seriously enough, or we're handling it too seriously, I beg to differ. You know, we're losing way too many people. You know, to get into the disparity in housing, you know, we want to talk about safe and affordable solutions in the state of Louisiana. And Judy actually touched on the first thing that I wanted to talk about. You know, I'd like to break it down into 2 different categories for the safe side and the affordable side. On the safe side, you know, we can think of it as far as physical safety, mental health, physical health. So I think on the safe side, one of the first things that we need to discuss is related to food deserts. For example, in New Orleans East is considered a food desert. If you ride around New Orleans East, what you will see are going to be gas stations with fried chicken vendors inside the gas station. You'll see a lot of fast food restaurants. One thing that you will not see is a fresh market. One thing that you will not see is a farmer's market. You know, the same thing is true in parts of my district, in District 97. So that lack of access to healthy, nutritious food contributes to what are being called those comorbidities, which are intensifying the impacts of coronavirus. So, you know, that's something that we need to discuss. Another issue is going to be the lack of availability for hospitals and healthcare resources. Again, I'll go back to New Orleans East. Prior to Hurricane Katrina, New Orleans East had, I believe, at least 2 hospitals. And those hospitals served not only New Orleans East, but they served to a large extent parts of St. Bernard Parish. They served to a large extent areas of Gentilly, which is my district. It took 8 years for a hospital to return to New Orleans East. The former Methodist Hospital reopened in, I believe, 2014 as New Orleans East Hospital. And we know that without proper care, without regular visitations to your doctors, if you have a chronic condition, it can quickly get out of hand. And also without that regular guidance and visitation with your doctor, you may not be aware that you have one of those comorbidities. And the final thing that I would touch on relating to safe housing is schools. You know, I think at least in New Orleans, we can all agree that for the most part, the neighborhoods around some of our consistently better performing schools are more affluent. They are, you know, better neighborhoods. They're safer neighborhoods. They're located in proximity to some of those resources that I just touched upon. You know, so that's another problem. You know, if you have a single working parent, or even 2 working parents, and they have to send their children to a school across town, 10 miles away, 5 miles away, 15 miles away, that just complicates matters. So those are 3 of the items that I wanted to touch on from the safe perspective. Now, as we go into affordable housing, you know, this is not just a problem in New Orleans. This is not just a problem in Louisiana. This is truly a problem throughout the country, right? And I think the most apparent reason for this issue that continues to intensify year after year is the lack of growth in wages. You know, and I think you have to start there. Louisiana as a state follows the federal minimum wage. that's $7.25 an hour. I think that's inhumane. I don't think anybody can survive off $7.25 an hour. So the members of the Louisiana Legislative Black Caucus, the Democratic Caucus, have consistently pushed for the state to set a minimum wage. There's been a new effort to allow municipalities to set their own minimum wage, because we know that, for instance, a family in New Orleans can't survive off the same budget as a family in Franklin, Louisiana. So those are important conversations that we need to continue having. Teacher pay raises, right? For years, our teachers were a strong part of our middle class in America. And what we're seeing today is teachers who just cannot survive off of what they earn in the classroom. They can't do it. I know quite a few of teachers who have side jobs, whether they are driving for Uber Eats, Lyft, whether they are bartending, whether they are catering events. They just don't make enough money in the classroom. So we need to keep pushing to get our teachers in Louisiana up to the Southern regional average. And the last point on wages that I'll touch on is equal pay. We know by and large in the country that our women in the workforce are being paid less than men for doing the exact same work. And there have been reports that have suggested women in Louisiana are making on average 69 cents on the dollar compared to men for doing the exact same work. And for our Black women, they're making under 50 cents on the dollar for the same work. That is unacceptable. And we have legislation in the House right now that would seek to end some of those practices to get us on an equal pay playing field. The next item that I would like to talk about.
Oh my God.
Okay, the next item I would like to talk about in addressing affordable housing is going to be our eviction policies in Louisiana. And I don't have too much time to dive into each of these items into heavy detail. Hopefully some of the panelists coming behind me will be able to get into some of that. But right now, our renters, our tenants don't have many protections. They're essentially evicted at the whim of the landlord, and that is unacceptable, essentially putting families out on the street. So there is a bill in the House right now that would seek to extend the period of time to where a landlord can evict a tenant, and that's a start. And I know organizations like GNOHA and Nika have some policy solutions around that. So I guess we need to collaborate and bring our heads together because we know in the Black community, when a cold is going around, we catch the flu, we catch pneumonia. So we know that our families are being evicted at higher rates than other races. The next thing that I would like to talk about, earlier I talked about the disparity among wages for a family in New Orleans compared to, Franklin, Louisiana, or another part of rural Louisiana. We have to acknowledge and understand that in some instances, we need local control. We need local control because our local governments are in a better position to set guidelines, protocols, procedures for some of these policies. And the way Louisiana's constitution is written right now, these local municipalities are preempted from doing so. So we need to remove some of those preemptions. Last year, Orleans Parish, a large part of Orleans Parish had property values reassessed. And what we saw was, beyond belief. We had 30% increases. We had 100% increases. We had people who experienced property assessment increases by more than 300%. And the reason for that is because Louisiana does not have a cap on how high those assessment increases can go up. I have a bill in the legislature right now that would cap those increases, but it would only be for the parish of Orleans. And the reason that I'm saying that is because Orleans has a problem with property values increasing too high, too fast. Other parishes have the exact opposite problem, and their property values are too low and they want them to go up. So we need to understand that sometimes local control is better than the state sort of dictating what we can and can't do. Another instance is going to be around short-term rentals. You know, I know that a majority of the state does not have an issue with short-term rentals, but here in New Orleans, what we saw is that once short-term rentals were, and that's like Airbnb, VRBO, where you can list your house out for someone to stay there for a few days, a week, whatever, right? That's the short-term rentals. What we saw in New Orleans when these short-term rentals became operational is an increase in rental prices. And that happened for a few reasons. Number one, we had locals who had property that they were renting out for long-term lease agreements who pulled those because they saw that they could make more money listing them as short-term rentals. Even if they didn't have it occupied the entire time, they could still make more money as an STR. So what that did was it reduced the supply of rental property that we had in New Orleans and pushed the price of rent up in New Orleans. So, you know, that's another issue that is somewhat local for New Orleans, but I would expect it to become more paramount throughout the state in years to come. Last year, the New Orleans City Council set down some regulations to, you know, combat some of the effects of their short-term rentals in the market. So we need to keep an eye on that, continue being vigilant and looking at smart policies to help the people of New Orleans, to help the people of Louisiana. Something else that, you know, I don't hear much discussion about is the Louisiana Housing Trust Fund. So that is a fund that is dedicated to helping very low income people with housing costs. We don't have, as a state, we don't have a dedicated source of funds that go to that trust. So I would like to see a creative way to divert some funds to the housing trust because I think that would be very beneficial for the residents of Louisiana. Now, obviously, with the impacts of coronavirus, state revenue in budget items are very precarious right now, and we still don't understand the full scope of everything. But moving forward, we need to keep an eye on that and look for opportunities to divert funds to that. And, you know, I'll close out with just, you know, some other ideas. When it comes to affordable housing, we know that for the most part, new development has to be incentivized, right? Because what you're asking is a contractor to build this construction and offer some of the units at below market value. So they have to be incentivized in order to do that. So I would suggest that we continue working together with our partners at the Urban League, with GNOHA, with the Black Caucus, to look at ways that we can come up with some new incentive, with some new incentives that may actually benefit some of our Black small businesses. Another thing that we need to look at are zoning restrictions, right? You can't throw up those developments in just any neighborhood. They have to be zoned properly. So another solution may be looking at some of those, easing some of those zoning restrictions, and that may better entice some of these developers to come to the table. And the last thing that I'll close out with is, you know, we're about a decade and a half removed from Katrina. And at least in the city of New Orleans, we still have properties that are vacant. We still have blighted properties that have existed since Katrina. So I think a solution that we should explore is using some of those properties and not just residential homes. We still have some city-owned property that is vacant. So I think we need to look at what the process would require in order to take some of those properties and use those for affordable housing. This is truly a crisis. I think in the country, United States of America, everyone should have the ability to go home at night, put their head on a pillow under a roof that they can go to regularly and not have to worry about that. I believe that housing is essential, and it needs to be prioritized as such. So, I'll wrap up with that. I really appreciate and thank the Urban League of Louisiana for organizing this tele-town hall. I'd like to thank all of my fellow Black Caucus members for stepping up and helping out all of our communities during this pandemic. And I'd like to, ask for everyone to continue praying for all of our families and businesses who are suffering right now.
Thank you so much, Representative Willard, for those remarks. We really appreciate you being with us this evening. Next up, we'll have Celina Davis, who is the President and CEO of the Louisiana Public Health Institute. Good evening, Celina.
Good evening, Judy, and thank you so much for having me today. As Judy mentioned, I'm Celina Davis, the CEO of the Louisiana Public Health Institute, a statewide public health organization that's committed to engaging communities authentically to design, implement programs, policies, and practices to ensure all Louisianans have the opportunity to be healthy and well. As I reflected on this evening's remarks around health and housing, I was reminded of this quote from Dr. King. Of all forms of inequality, injustice in health is the most shocking and inhuman. That was true when he said it a little over 50 years ago, and is still true today. I ask that we all reflect on how Dr. King's legacy can be used to think about equity and what are those conditions that must be transformed in which people are born, grow, live, work, and age for our communities to be healthy in our minds, bodies, and spirits. Because we know that health is not just determined by our biology or access to health care. So now focusing on where we live briefly, we know that where we live is at the very core of our daily lives. The data is clear. Families that are in substandard housing, unstable housing, experienced forced moves, or are homeless are more likely to experience poor mental or physical health. Housing is a public health issue. Most Americans spend about 90% of their time indoors. And we know now during COVID, most people are spending probably close to 100% of their time indoors if they have a home. And an estimated about 2/3 of that time is spent with very young children inside. And if the conditions are especially vulnerable to household hazards, that has a potential ability to be harmful. Factors related to housing have the potential to help or harm our health in significant ways. I want to look at 3 important and interrelated aspects of housing and their links to health, according to a great report that Robert Wood Johnson Foundation put out. The physical conditions within homes, the conditions in our neighborhoods surrounding our homes, and housing affordability. First, healthy homes, referring to the physical conditions within our homes, promote good health and good physical health and good mental health. Good health really depends on having homes that are safe and free from physical hazards. Alternatively, substandard homes contribute to health problems like asthma and other injuries and can have harmful impacts on child development, placing children and families at greater risk for multiple health problems. And we're seeing that on a day-to-day with this COVID-19 virus. Secondly, along with conditions in our homes, conditions in our neighborhoods where homes are located, such as the social, physical, and economic characteristics, continue to have profound impacts on long-term health quality and life expectancy. And we just heard a lot about that from our panelists earlier. For instance, I'm based here in New Orleans, Louisiana, and when we look at life expectancy in the Central City and Audubon neighborhoods, in Central City of New Orleans, our life expectancy of the people there are in their mid-60s, compared to in the Audubon neighborhood, life expectancy is mid-80s. There's a 20-year gap, and that was recent data that the city just put out. So what are the conditions in the neighborhoods that resulted in this outcome? Our neighborhood characteristics that make the healthy choice a readily accessible choice provides things like places for children and their families to play and exercise in areas that are free from crime, violence, and pollution, and also provide access to groceries so that we can avoid the food deserts that Representative Willard was discussing earlier. They also have social and economic conditions in neighborhoods, like having employment opportunities or public resources, like efficient public transportation and good high quality schools for all. However, we know that not all neighborhoods enjoy these opportunities. Finally, the shortage of affordable housing limits our families and people choices on where they live and often relegates families or individuals who have lower income to substandard housing in unsafe, overcrowded neighborhoods. And in short, in order for us to create healthy housing, we must have fair and affordable housing, among adopting other broader social policies that address livable wage, equitable access to high quality childcare, and universal pre-K. And without these larger strategies, no amount of clinical interventions, health insurance coverage, and health education will help us achieve good health outcomes for all people in all communities. Thank you.
Thank you so much, Celina, and we really appreciate you giving us that overview and frame for our panel discussion. Let's bring Sheba Turk, who is WWL TV news anchor, up so that she can begin to introduce us to our experts in affordable housing from across the state of Louisiana. Sheba?
Thank you so much, Judy. And yes, we've already heard how housing and health are connected, and that's what we'll be talking about during this panel. We have some amazing affordable housing experts who are going to draw those connections to us, talk about the state of housing now, how this pandemic is exacerbating problems that we already saw, and what needs to be done to try to get things on a better path. So I'd like to introduce first Ms. Nika Morris, the president and chair of the Greater New Orleans Housing Alliance. Thank you so much for being with us for this conversation. And can you start by talking about how we weren't in a good place with affordable housing? I know you were one of the many groups working on this before this pandemic even started.
Sure. Good evening, Sheba. Thank you so much. And I'd like to thank the Urban League and the Legislative Black Caucus for hosting this event. And so, yes, we were not in a good place here in Louisiana before COVID-19. We're starting to say pre-COVID and post-COVID now because our world has changed dramatically. But unfortunately, one thing that has not changed is the level of housing insecurity that our people have been struggling with. This has been it's been a big wake-up call and a big clarifying call that this issue is how incredibly important this issue is right now, because right now, staying safer at home is one of the best things that we can do. But far too many of our families, a safe and stable home is just out of their reach. And this is something, again, across the state, not just in New Orleans, Baton Rouge, and Shreveport. We've seen problems in Lake Charles, for example. They have been experiencing a pretty textbook case of gentrification in Lake Charles, right? It's not a place that you could think about, but in the past few years, their problems have worsened to the extent where they have street homeless, people living under bridges, people pushing shopping carts, and they don't have the infrastructure to deal with that. They did not have a shelter when this happened, and they have responded as best they can to this, but it is textbook displacement by workers coming in and driving up prices, and it's been a struggle for them to respond. In Homa, again, before COVID-19, there were quite a problem with homelessness, as well as a problem with returning citizens, folks who were being released from incarceration. In Alexandria, we saw sky-high utility costs, making it incredibly hard for homeowners and renters to keep their head above water in Alexandria, Louisiana. And of course, in New Orleans, where the problems were so extreme that they don't even make sense. In New Orleans, in the 6 months prior to COVID, over 300 families lost affordable housing in the 6 months prior to COVID. So now the problem is compounding at an alarming rate because unemployment is soaring and it's going to continue to do so. Here, especially here in New Orleans, where hospitality and tourism are going to be slow to come back to their pre-COVID levels, and those folks need urgent help now. And so while the link between housing and health has never been more clear, and we need more protections to keep us in our homes, we have seen not the fastest response to this, and not a equitable response, and not a substantial response on our leaders. Again, starting pre-COVID, state of Louisiana doesn't spend any of its own revenue on supporting its citizens. Representative Willard mentioned the Housing Trust Fund, the State Housing Trust Fund. We have been advocating for several years that trust fund needed to have a dedicated revenue source. We suggested sources, again, using things like Airbnbs and short-term rentals to seed that funding. The money went other places. And most bizarrely, in the last year, we actually gave short-term rental taxes to the tourism industry to pay for marketing in the last few years. So we have not prioritized housing. Our leaders at the state, city, and local levels have not made this a number one priority. One other challenge that we have is, again, after Katrina, the state of Louisiana had billions of dollars to rebuild housing. We rolled out programs that rebuilt a lot of housing, got a lot of people back home, but we didn't go far enough. As Sy mentioned, we didn't go far enough to preserve affordability, to make sure that as these neighborhoods came back stronger, they wouldn't be displacing the people who had called those neighborhoods home for generations. That's what we're seeing, not just in New Orleans, but across the state. And one of the biggest problems with this is that there is enough room for everyone. Louisiana is not San Francisco. It is not New York. We do not have a huge crush of people coming into any of our communities. We have a lot of vacant and blighted and substandard housing that we can't seem to figure out how to fix. And so there's not even really a run on quality housing. In New Orleans, for example, estimates tell us that we have over 7,300 vacant apartments at the start of this pandemic. 7,300 vacant apartments, while people who can't afford to pay rent, who have assistance, can't find housing. There's a mismatch here. And when we talk about the funding that we had post-Katrina, again, there's still money that's still left over. As of March 3rd, the state of Louisiana had over $39 million for the Road Home program still at its fingertips. That funding's restricted, but we need to be being creative and innovative. And again, the homeowners who were helped to rebuild across Louisiana, they're certainly in trouble now. Could those funds be repurposed to help stabilize them? We're going to be seeing millions of dollars coming down in CDBG funding and emergency shelter grant funding and energy assistance funding. That money has got to get out on the street as quickly as possible, and we've got to sustain folks for the long run. We've got to align these resources. We've got to make it a priority that people can get the support that they need to stay in their housing. The relief must be real. It must be doable, and it's got to be practical. And again, because we won't actually be able to, again, a lot of industries will not be paying wages at all. They will not be reopening for quite some time. And again, this crisis requires that everyone have a home. The next wave of this pandemic, we can't be as slow to get everybody sheltered in place and sheltered at home. We have to be ready for it. So that means dedicating the resources that we already had, prioritizing the citizens, and making sure that they have safe, decent, affordable housing for now and for all time. That's where this has to go. We have to put housing first, finally. And again, Louisiana has the ability to do this. This is not a traditional affordable housing crisis. In other places, they have too many people and not enough units. That's not a problem here in Louisiana. That's not a problem across the state. We are seeing a misalignment of resources. We're seeing markets that just don't function, and it is the role of government to intervene and to correct those markets, particularly inside of this pandemic. So that's why I'm so pleased to be on this call, sponsored by the Louisiana Legislative Black Caucus. We hope to see legislation. I heard some really good policies that we hope to build on and to continue to address this crisis now and for all time.
Yeah, and Nika, before I move on to our next panelist, you spoke about relief. I know one thing that was helping was a halt on evictions in our area, but that is set to expire next week. How long do you think that something like that needs to go on so that people actually have time to get their finances back in order?
Again, I don't think that forestalling evictions are the answers. We need to be providing rental assistance. Here's the thing about forestalling evictions. At what point does someone who was cost burdened on March 1st, how are they going to ever catch up to 3-4 months of rent? How? There is no scenario where that works. And while there are problematic landlords, certainly, there are people who are renting are slumlords. The fact of the matter is that there are genuine expenses that have to be paid, like insurance, like property taxes, maintenance. There has to be funding coming in to cover those costs in order to maintain the housing. It's fun to just call landlords greedy and terrible, because there are a lot of really bad ones. We've seen horrible examples of truly terrible people just behaving abominably in this crisis. But for the good landlords, and there are quite a few of them, there are genuine expenses that can only be met by providing resources. Other communities that have talked about, we've seen them, and we want to support the idea of, you cancel rent and you cancel mortgages. You have to have the funding available to make that happen. That you can't eliminate the obligation, but you can satisfy it. That is what we need to be doing. That's what the resources that we have, that we're going to be getting from the federal government, that the state and the cities already have on hand, that they can get from FEMA. That's what we need to be doing, satisfying these obligations.
Sure. Thank you so much for weighing in, Nika. I'm going to bring Omari Hosang into the conversation now, the founder of All Streets, All People. You can take a look at what they're experiencing in the Shreveport area. I understand there you make $16.92 an hour to afford a 2-bedroom and not be cost burdened, which we know most people are not in that situation. Omari, please tell us what you're seeing and experiencing in Shreveport.
Thank you, Sheba, and thank you to the Urban League of Louisiana and the Legislative Black Caucus for sponsoring this conversation, and just thank you for your leadership. And thank you, Nika, for thinking of me and recommending me for this very critical discussion. First, I do want to say, yes, $16.92. Over 60% of folks in Shreveport, Louisiana, can't afford or are cost burdened, and that is over half of the folks that live there. And so I really wanted to uplift this statement, kind of to center the story and the experience that I want to share quickly. And it's the fact that impacted folks that are impacted by a lack of affordable housing, folks that are unhoused, they must be educated, empowered, and engaged in this process, because I was an impacted person. And when I found out through Housing Louisiana that I was cost burdened, it lit a fire under me that I don't believe will go out. And so just to kind of briefly put my story into context, in January of 2016, I was fired from my job. And after 4 months of trying to make ends meet, I ultimately had to move out of my place that I was staying in, that I was renting. And thankfully, I had a good friend who allowed me to stay with them for a while to get back on my feet. And it was hard. It was difficult. I did almost everything I could to make the money, save the money to move into a place, almost even move back to my home state of Alabama. But things started to look up. I got a job. It wasn't high paying, but it was enough to find a place within my budget. Which again, my budget wasn't huge. And so I found a place, and the place was affordable, but to say it was substandard is an understatement. I mean, there weren't the proper locks. There was extensive damage from past tenants and lack of maintenance. Perhaps the building was condemned before I moved in. But the process was accessible. It was an extensive background check as far as my credit and my income, and I was able to move in easily. So I sacrificed comfort and even safety for affordability. But the tipping point for me and my child, who was 7 at the time, was one evening we were returning home and just standing on the porch talking to a neighbor, and a passerby came and attacked my neighbor, and we had to flee into our home. And at that point, I knew that I had to prioritize safety and comfort over affordability. And so we moved. We were fortunate enough to move. And honestly, we were comfortable, we were safe, but we were cost burdened. And it wasn't until I went to a listening session that Housing Louisiana hosted that I found out that I was even cost burdened. And I think that is so important. That's an important piece. And that's why I started with impacted folks. I didn't even know I was impacted. And honestly, before I found out I was cost burdened and before I started going through my struggles, I thought that struggle had a look, right? It had a certain person was someone who couldn't afford their housing. But as I found out, that is completely untrue. And so through the lens of my experience and what I've seen from folks on the ground, I like to just quickly lift up the implications and intersections. And before I do that, I want to say that I called almost all of my friends and I started asking them, I was like, hey, how much do you make? How much are you paying for housing expenses? And though it wasn't taken well, and it's not recommended for y'all to call up your friends and ask them that ratio, it was just astounding how many of my friends and folks that I love and other folks that I knew who were cost burdened and had no clue. And so there are three things I think in terms of before COVID, during COVID, and really after, the implications, the interlocking injustices that I want to lift up. And first, when folks are cost burdened, they spend less on food, they spend less on transportation that they may need to get to work, they spend less, and I think the implications of this during COVID, they spend less on healthcare, right? Because they're spending such a large portion of their income on affordable housing or on housing. And that includes rent, their mortgage, the utilities, all of that is included. The second piece that I think is really interesting, especially in terms of Shreveport, is the stigma, right? And so it's not just there's a look to someone who's going through struggle, but the stigma of what affordable housing actually is. I find from conversations in the community, from seeing when affordable housing developers come and they make their proposals, that there is such a large pushback from the community because there is a kind of a conflating of affordable housing with a project, which is seen as an undesirable element, right, in our neighborhoods, in our communities. And so that further kind of pushes the stigmatization of folks who really, really, really need safe, affordable housing. And the third piece I really want to uplift, especially in terms of the health crisis that we're in, is the emergence of the new essential worker. What we thought was an essential worker before this crisis has greatly shifted. And now it's your grocery store workers, it's your grocery delivery folks, it's the folks working at the city, the folks working for the sanitation department. They are our essential workers. And unfortunately, they are also low-wage earners, those who may have to work more than one job just to afford going home to a safe place at night after, especially during this stressful time, after a very risky and hazardous day at work. And so through the work I'm doing with ASAP, All Streets All People, our focus is the uplifting, the engaging, the educating, and the empowering of impacted folks. Because when we have been through it, we should be able to speak to it. And so that's why I'm so grateful for the efforts of Genoha and Housing Louisiana to educate us on the ground. Because again, now that I know that I've been through it, now that I know what I was going through up until April 1st, I was cost burdened. It has a different kind of tinge, right, when I'm dealing with the situation, because I know how it feels. And so one thing that ASAP is doing is organizing and bringing folks around this affordable housing crisis, organizing and bringing folks into this digital space, right? We're here on GoToWebinar. There are 154 folks that are watching, which I think is amazing. But we also have to lift up the fact that many folks don't have the same type of access to internet, but the issue still exists. And so one thing ASAP is working on is bringing more impacted folks into this digital organizing space so we can continue having these critical conversations, figuring out how we can meet our needs, how to craft a demand, what our demand should be, and who is it that we address our demands to. And the last piece is I'm also, April 1st, I started as the Louisiana coordinator for the Black Voters Matter Fund. I recognize that we're organizing folks to build power, to make the demands during this crisis, whether that be legislatively or on a local level. But we also recognize that folks need what they need when they need it. And so one thing that Black Voters Matter Fund is doing is helping grassroots organizations and individuals that are doing work to provide some of those intersecting needs, whether that be transportation, food, some of those needs that are being sidelined at this time, providing the mutual aid that's needed and providing capacity to those who are providing mutual aid. So I really want to lift that up for folks that are doing this work or trying to meet the needs of folks going through this crisis, that Black Voters Matter Fund is there to help build capacity so we can continue to save ourselves. But it's just really important that we remember, ultimately, out of all of this, that though folks are going through a crisis, folks are impacted, folks are struggling, ultimately it's those folks that are impacted that can help to be the driving force, the loud voice, and the passion and fire behind getting the things that we need to get done.
Yeah, Omari, thank you so much for the work you're doing and for sharing your personal story. I think a lot of people can relate to that. They probably don't even realize that they're cost burdened and need some help through this. All right, thank you so much. I'm going to bring Ellen Hill, Department Director for Planning and Urban Development for the City of Monroe, into the conversation now. We want to know what things are looking like in Monroe, and we've gotten a sense of this problem now from our first speakers. So I'd also like you to kind of start getting in the area of what you think needs to be implemented to move things forward after this pandemic passes. Ellen?
Thank you so much. Thank you. Can you hear me?
We can hear you, yes.
Okay, so thank you so much to the Urban League and to the Black Caucus for having this conversation, because it is important, and it's a conversation not only for today that we're talking about COVID and the pandemic, but a conversation that needs to continue and build. So I'll start from the fact that being a city worker, people tend to think of government as the problem, but I do believe that we can and must be not only a part of the solution, but a driving force in coming up with innovative partnerships in order to address the needs of our most vulnerable populations. And for us in Monroe, housing was an issue prior to COVID, and COVID just made us look at housing and perhaps accelerate some of the things we recognized we needed to do. So in Monroe is one of the cities across our state that's a majority renter city, and a city that also probably hasn't really had a push for affordable housing to allow people to truly buy houses in the last 20 years, maybe longer than that. So as the department charged with working on development and working on housing, we've sought to not only look for ways we can take the federal funds that we have and invest them differently in housing, but also ensure that we truly make the situation better and find partners in our community, both in terms of nonprofits. So we partnered with a CHODO, for example, but then also partnering with that CHODO to seek larger philanthropy dollars and bring them into our community. I've heard the panelists talk about building capacity, making sure that we're we're better able to help people figure out how to advocate. But something when we think about building capacity, you know, we've thought about how do we build capacity for the people who want to do something in their community about affordable housing, but don't always have access. And when I say access, I mean access to capital. So working on building partnerships with the banking community to have them realize that they can invest in affordable housing. We can invest in what I call our older traditional neighborhoods, you know, the neighborhoods that suffer from disinvestment. But let's call them older, traditional, rich heritage neighborhoods that were the cornerstones of our cities years ago as places we need to figure out how to invest. So in Monroe, pre-COVID, we were marching along with the idea that we needed to build the capacity to have affordable housing and not so much focus on replacing rental housing, but new affordable houses that residents could purchase. COVID hit and it allowed us to have the opportunity to truly sit back and think, how do we help our renters who might not be ready for home ownership, but need decent housing? So for us, we've decided we needed to step back and look at building our capacity to really address both ends, both the home ownership end for our lower wage workers who are now all the essential workers, but also work on assisting with foreclosure prevention. We have those marginalized folks and residents that we might not have thought of as essential until COVID, you know, might have bought a home. And so now they're stressed with the situation they're in. And so we need to ensure that they do keep the houses they have. So we want to do foreclosure prevention counseling and assistance, because the one thing we got from the federal government is the freedom to do a few things differently and to experiment. So we're going to experiment, for us, it seems radical, with rental assistance, because we've never done that as a city. And so setting up a rental assistance program, not just paying rent and utilities, but also look at counseling, financial, I hate to say counseling, because really what we want to do is set up a system of financial coaching and working on helping people achieve financial stability. And we also want to do rehab assistance for rental property, and that's radical for us. But we recognize if 56% of our residents are renters, and we know that affordable houses have not been built, have not been in development for years, then people are living in substandard houses. So how do we partner with landlords in a different way to improve our housing stock while also providing those renters with stability? And you know, we know that housing is first. If you're stable enough at home, perhaps you can think of the other things you need to do. And so if we can have a program that allows us to not only help build affordable housing on, you know, as Nika made a point about the empty lots, it might have been someone else on the panel that talked about vacant property. We, for example, looked at property in one particular older neighborhood in our community and recognized that we had over 50 either vacant or property that's been adjudicated beyond the period that we should be able to have someone buy those properties. So how do we work with local folks that want to develop property to get those lots developed into affordable housing? then how do we look at the rental property and look at a landlord, work with that landlord to get that rent affordable for the renter, stabilize that renter, and then work on what would be their future housing needs. Do they want to stay a renter? According to I say anecdotal information, the rumor is that a lot of millennials don't want to buy, they want to rent. I have a millennial, he'd like to buy a house, nobody's building for him. So we know we need affordable housing that has a spectrum, and we need to have those types of opportunities in our community for it to be a vibrant city post-COVID. And while we say post-COVID, I just say, you know, the new reality means that we will have to ensure as a public entity, we do develop innovative partnerships that lead to real solutions and are results driven. It's not good enough to just say we're going to have a program, but the program has to yield the results needed. And so we're excited about the opportunity to really focus on housing as a cornerstone of development for our community, but more importantly, affordable housing.
Sure. Yeah, Ellen, thank you so much for being part of this conversation. You brought up several issues. I'd like to bring in Alfredo Cruz, the coordinator of Housing First Alliance in Baton Rouge, to weigh in on. Alfredo, we've heard several suggestions from our panelists so far: rental assistance, foreclosure prevention assistance, financial coaching, building new affordable housing. I wanted you to jump into the now and talk about some your organization has for strategies to tackle this housing crisis after the pandemic.
Sure. Thank you for this discussion, and I certainly appreciate the opportunity to share some ideas. But I also appreciate the lens through which we're having this discussion, a lens that really elevates housing as a public health and a security issue. And it's one that I think it's going to be necessary in order for us to finally see perhaps some major investments in the housing trust fund that both Representative Willard and Nika have already mentioned. I think that's where I want to start. You know, we need an affordable housing trust fund in Louisiana, and there's no reason why we shouldn't have one. This crisis presents us an opportunity to be able to think more strategically about how we prepare the state and our citizens for future pandemics, for future disasters, and recognizing that housing must come first because of both the public health and the security of all Louisianians. We may perhaps finally see the light bulb go on for many legislators that have opposed funding this trust fund. And I hope the Black Caucus champions during the next session or the next session a dedicated source of revenue for the trust fund. Baton Rouge was already experiencing a lot of trauma, both after the killing of one of its residents, the shooting of police officers, the protests that happened here, and then the 2016 floods. The communities of color that have been impacted, the Black citizens that have been impacted by all these man-made and natural disasters that have occurred, are now facing the blow of this pandemic mostly. And what we need to focus on in any approach is a trauma-informed approach, because we have to recognize that people are experiencing trauma, and people have already been experiencing trauma for years, since before this pandemic. And the sooner we can come to solutions for housing stability, the sooner we can begin to treat people's trauma and ensure that we don't have another generation of children growing up multiple layers of trauma and dysfunction. I want to just talk about 3 concrete things that in Baton Rouge we're trying to champion for the use of CDBG dollars equitably to make sure that we're investing more of those dollars in the families that need them the most. Baton Rouge has received 1.9 million of CARE Act CDBG monies. But it's unfortunate the very agency that needs to ensure the delivery of those funds happens equitably faces a budgetary shortfall of about $362,000. And if we don't ensure that the very agencies whose responsibility is to disperse funding and to carry out projects to benefit our community, if those agencies and organizations are not well funded, then we're not best positioned to succeed and to make it through this pandemic. We need to advocate our congressional delegation to ensure that there's ample funding to local governments in the next CARE Act, so that as we're asking more of local governments, of people like Ellen, as we're asking them to do more in their jobs, that they have the best resources possible to support the people doing those jobs. We also need to make sure that the essential services grant funds, the ESG funds, are equitably distributed and used for emergency and intermediate housing support. Things like hotels and vouchers that can be used to help people who are either homeless or at the verge of homelessness. But we need to make sure that that money is used smart and is not just pushed out the door because there's some spending deadlines. It needs to be spent wisely on those who need it the most. And let's not forget about the savings from the criminal justice reform that we saw years ago. There are people waiting to be released from jail and they have nowhere to go. And Baton Rouge is one of those communities that has been receiving a lot of formerly incarcerated residents. And we don't have the much needed affordable housing options for them. And so we need to think strategically about how to use some of those savings from the criminal justice reform that happened years ago and use some of those savings to provide quality, affordable housing for that population that's hard to house because of restrictions, both by public housing and by the private market. We have a lot of work to do, and we need people to do it. And we just cannot continue to do this work and fix our issues without properly funding and securing the capacity of our local governments, agencies, and nonprofits that are doing this work. And many of you listening tonight represent those agencies, those local government, and those nonprofits. And so I invite you to advocate stronger for the funding necessary to get this work done properly and to align the investments so that we can get through this crisis and prepare us for the future disasters that are inevitable. Thanks again for letting me participate. And I hope everyone stays safe.
Yeah, thank you so much. We appreciate you weighing into this conversation and bringing some ideas about how funding can be reallocated to help with this crisis and unfortunately pandemics that we could see in the future. Alfredo, thank you so much for joining in. I'm going to turn things back over now to Judy Reese-Morse. Judy?
Thank you so much, Sheba, for moderating that really, really important conversation. And thanks to all of our panelists, tremendous information, whether it was New Orleans, Monroe, Shreveport, or Baton Rouge. We can see the thread that is running across our state as it relates to affordable housing. We did get one question that is directed to Nika Morris, and the question is, Are there resources available for homeowners who are having trouble dealing with the banks and lenders and not being allowed to delay mortgage payments? Nika, if you can hear me, we need you to unmute your mic. Thank you.
Yep, got it. Thank you. Thank you, Judy. That is a great question, and I'm sorry that we didn't get to that because it is a big problem. We talk a lot about renters and homelessness because they were on the front lines, but homeowners are also at risk during this pandemic. And again, we are talking, that's why we've been talking about utilities and rental and financial assistance, because the same kind of advocacy that's necessary to push to make funding available for the landlords is what's going to be able to make funding available for homeowners. Right now, there's a piece of legislation that has been introduced to actually cancel rent and mortgages by satisfying those debts. And so that's the kind of pieces that we need. If your mortgage company is refusing to work with you on loan modification, you can reach out to a Homebuyer Counseling agency. There's a Louisiana Homebuyer Education Collaborative, and we can help you find a home buyer counseling agency that can help you with that. Those foreclosure prevention specialists who are certified through HUD can help you negotiate with your mortgage company is the answer for right now, but we need policy changes. We need funding made available to satisfy these expenses.
Thank you so much, Nika. We have another question, and this one is for Omari. The question is, what barriers are keeping people from attaining affordable housing? We're going to bring up Omari in just a second.
Can y'all hear me?
Yes, we can hear you.
Okay. So as far as the barriers, and I know y'all can't see me yet. As soon as I get the request, I'll accept it. But, oh, I see it. All right. So what I'm seeing there are many barriers, but I think two of the prominent ones are, number one, living wages, because what I'm seeing is that folks who are having issues accessing affordable housing is not because they're not working. They're working. It's that the fact that their wages are not sufficient enough to be able to cover their housing without being cost burdened. So I see that a lot, a lack of affordable living wages. The second piece is when just a lack of education and information, because again, I didn't realize I was cost burdened until a few months ago when Housing Louisiana had a listening session. And so I think there needs to be, especially in this age where everything is on the internet and now everyone is on the internet for everything, that we have to flood folks with information and follow that up with organizing where folks are building relationships with people around this information. So not just putting a whole bunch of information out there, disconcerted in separate pieces, but putting it together cohesively and having folks that are strong and who understand this issue to connect with people on the ground where they are. And so just to kind of sum up, the two biggest, and I'm sure there are more, but the two biggest ones that I see are access to living wages and access to information.
Thank you so much, Omari. We appreciate you so much being a part of this panel discussion. I'd now like to bring up another member of the Legislative Black Caucus here in the state of Louisiana, Representative Marcus Bryant, who is going to give us closing remarks. Representative Bryant.
Hi, thank you. I'm Representative Marcus Bryant. I represent House District 96 here in the heart of Acadiana. I just humbly want to say thank you to all our listeners for joining this great tele-town hall series on day 2. Housing is the best medicine. Please register and join us tomorrow to discuss salaries and wages. We know faith without works is dead. So stepping up today and joining the series to get the tools and knowledge to go do the work that is necessary and to affect change and policy in your community is a great step towards affecting change. Finally, thank you to the Urban League of Louisiana for the great work you do in putting together this type of series for our citizens. to the speakers, like said by Ms. Sheba. Thank you for being aspirational, inspirational, and informative. And that's it. We'll see everyone again tomorrow.
Thank you so much, Representative Bryant. We
Thank
are
you.
so happy to again partner with the Louisiana Legislative Black Caucus on this town hall series. As Representative Bryant just mentioned, we invite you to join us tomorrow for night 3, when we will focus on salaries and wages as a social determinant to health disparities. We are trying to lay out some of the contributing factors to explain the reasons why so many African Americans in the state of Louisiana are dealing with health disparities and the impact of COVID-19. So tomorrow is salaries and wages. We start at 5 p.m. Central. Tomorrow, if you have not registered, please go to the Urban League of Louisiana's website. You can register for night 3, and our final night, which is Thursday, will focus on entrepreneurship. We know that that is a big topic for many across the state of Louisiana, so you can register for both of those, and we hope to see you then. And finally, but certainly not the least of what we should be focused on, is the 2020 census. I want to remind you, and I'll try to remember to remind you each of the remaining nights. Please, if you have not completed your census form, please go online or go to the Census Bureau's website and request that a form be sent to you so that you can respond to the 2020 census. Much of the money, federal dollars that we rely on, that our communities rely on across the state, are federally funded programs. And those formulas are determined by the response rate of the 2020 census. So it is critical that we pay attention and respond. Go to the Urban League's website if you want a link to the U.S. Census Bureau's website, or go directly to the Census Bureau's website. Please respond. Tell everyone that you know to respond. This is very, very important, and we will continue our work here at the Urban League, getting the word out about the census. Thank you, everybody. We appreciate you being with us tonight, and we look forward to seeing you tomorrow evening, 5 p.m., same place, same time. Thank you.
Thank you.